Now we move to Europe, and we have Icro from Italy.
Hello, hello to all of you.
Hello, Icro, we can hear you.
Yes, sir. Yes, sir. Can you hear me? Yes, sir. I am Icro Maremmani. I am a psychiatrist. I worked for 40 years in the University of Pisa. Now I am retired from the hospital, but I continue to teach addiction medicine in the University of Pisa at Unicamillus Medical University in Rome, Italy. What about EUROPAD? EUROPAD was founded in Geneva, Switzerland in 1994, and currently has around 2,500 members as readers of our journal. We have developed a network to facilitate communication and cooperation, and currently we have EUROPAD chapters in 29 European countries, plus Russia and Israel. We are co-founder of the World Federation for the Treatment of Opioid Dependence, that is a non-governmental organization with a special consultative status with the United Nations. We are publishing since 1999 our official journal, Heroin Addiction and Related Clinical Problems. Every 2 years we have a congress, the next in May 2024 in Pisa, Italy. And every 18 months we organize a symposium with the American Association for the Treatment of Opioid Dependence in the United States, next in Baltimore. Next slide. What we expect from ISAM, a better worldwide visibility for opioid treatment and opioid dependent. And we want to encourage and support research, especially with our journal and our collaboration during our meetings. Thank you.
Thank you very much. Now we move to Malta. Anna Maria Vella.
Hello everybody. I'm Anna, and we'll be talking today about CzMA. So CzMA has been there since 1994. Now, when we talk of Malta, we're talking about a population of 500,000 people. So when I say we have about 115 employees in Agencia CzMA, that means they are doctors, social workers, psychologists, and the whole counselors, youth workers, whatever. We have always thought of working in the preventive, medical, and social services field. So since 1994, we have consolidated quite a lot these services that we offer. We act a lot in a multidisciplinary team. It's not doctor-based, it is not doctor-led. It is more led by social workers and other key workers which are who are in the different fields, and the doctors are part of that team. So as a national agency, we try to give as best as possible our services. Anybody who knocks at our door, we really boast about no waiting lists. Anybody who comes today will be seen within 1 week by a doctor, a social worker, and a psychologist within a week. And we have calculated that we have a catchment population of about 85%. And that is something I really am proud about. Our latest challenge has been the legalization of cannabis and how it is going to affect the young population and people who are in their experimental stage. Okay, next slide. What do we expect from ISAM? Well, we want to learn new modalities, especially with regards to behavioral addiction. So COVID has brought along a lot of problematic use of the internet, and people are coming asking for help. And we want to know how other countries are treating these people. Obviously, networking has been the word of choice for this meeting. Yes, we want to network because we want to learn. We are happy to showcase our services and get feedback to get them better. That is very important. What can we contribute? We have a lot of knowledge, we have a lot of data, we have a lot of people who have become experts, and we are happy to share our knowledge. Being a small island, we have particular needs and attributes, and I think we, as an island in the middle of the Mediterranean Sea, can reach out, as we have already done with various countries in the world, where we can offer our help and expertise. And we would like to be more part of the research team that ICEM contributes and does. Okay, next slide. So I want to say this. Please come to Malta. We are organizing ICEM Valletta 2022 from the 4th to the 7th October. It's going to be in hybrid form, but we really hope that many of you will come over, and again we'll have that beautiful feeling and experience we had in India as last conference. Thank you, everybody.
Thank you, Dr. Vella. We look forward to seeing you in Malta.
Yes, I'll be there.
Now we are moving to Greece. We have Athanasios Theocharis.
Hello from Greece. I'm Athanasios Theocharis, the president of the Organization Against Drugs in Greece. If we can go to the next slide, please. Okay, the Organization Against Drugs, named OKANA, it's the largest service provider, public one, on the field of addiction here in Greece. And we have four main pillars that we act. It's prevention, treatment, harm reduction, and direct access and social reintegration. We have several sites that the organization functions, and we have in prison, in no-state treatment infrastructure, and we have drug-free treatment programs, as well as the prevention centers and the reintegration programs that we have all over Greece. We talk about population, working force of around 1,000 employees, from which we have around 120 to 30 medical experts, mostly psychiatrists or GPs. And the other categories are nurses, are social workers, psychologists, and special therapists, people who come from programs that have finished our programs. And we talk about 99,500 beneficiaries in no-state treatment and drug-free treatment programs, as well as more than 5,000 beneficiaries in harm reduction. So our priority is to have better access for drug users with an overall approach and a very integrated approach, from harm and risk reduction to treatment, housing, hygiene, or primary health care and social reintegration. We have great news now. The challenge is the opening of the DCR that we are having this month on function, and the 5 mobile ones that will come after that, and the shelter operation that will be to help us for the housing all the people which are homeless. We have needs for example, we need to see the services for new entries, such as shisha or cannabis at early stage and legal addictions. And as far as services concerned, we have naloxone spray for first time in use. This is great news here in Greece. And we have outpatient clinics as well as mobile units in our operation. Next slide, please. So what we would like to, we expect from ISAM is to have sharing on knowledge, expertise, and best practices in other organizations or in other prefectures in the field of addictions, as well all the insights from challenges faced by ISAM organizations. So we need also networking, because we believe in networking. And also we would like to see if we can set new strategies in order to address to the global problem or to the needs of drug addicts. So we can contribute by best practices carried out by OKANA in Greece, as well as we can present the integrated approach that we have. As I told you, we start from harm reduction from the field to the treatment and to the housing. We have an overall approach, and we would like to communicate the challenges and the new substances in the field of addictions in Greece. Thank you very much for hearing us.
Thank you very much. Thank you very much. Now we go to Iceland, and we have Valgerður.
Yes, thank you very much. Hello, can you hear me?
Hello, perfectly well.
That's good. It's a great meeting, very fast, but a lot of information. I'm happy to be here with you. So I live in Iceland, where we have like 360,000 people, so even smaller than Malta. And we have here over 40 years experience with the SAO, which is the National Center of Addiction Medicine, that has been treating people with addiction since 1977. And today, this is the biggest or the main treatment center in Iceland, and treats all kinds of addiction: alcohol, cannabis, stimulants, prescription drugs, and what there is, and gambling also, and families. And this is free for the patients. It's covered by the health insurance. So basically, addiction treatment is in Iceland considered one of the general health care, and accepted as that. So that's a very good environment that we're in. So SAO has already treated 7% of the population, adult population. So maybe half of the people in need that if we could say so. So we have inpatient and outpatient rehab. We have inpatient detox hospital, and very different specialized treatment groups depending on gender, age, and such. And we have all just health professionals working in our centers. And now the situation now, we have this good access and acceptance and other healthcare for people with addiction. We have been seeing more opiate use disorder in the last few years, so we have increased the treatment for that as well, with the medication and psychosocial treatment. And also, we see now during COVID, there was actually a reduction in problem with, for example, young men. But now we are seeing again increased need for treatment as the COVID is going down. You could say so, that everybody's more relaxed now, and we are seeing a lot of new people coming in for treatment, especially young men. And during COVID, we saw a lot of severe consequences of alcohol drinking in adults, but so we will see what happens in the next couple of years. Next slide. What we see as what ISAM can give to us, it has already given me a lot of information about the problem or the services all around the world, which is very delightful and encouraging. But of course, this, I think ISAM is so very much important to increase the emphasis on the urgent need to care for people with addiction. It's such a common problem, and it needs to be regarded as it is, and hopefully also collaboration on guidelines and lots of other things. You cannot list many things in such a short time. What we could give out as help to others from the little Iceland here is that our 40-year experience in the comprehensive treatment on multiple levels, but also these two things, which are treating hepatitis C within the addiction treatment settings. And we have been the key element in eliminating hepatitis C as a major health threat in Iceland, which has been going very well. And we have treated over 95% of the hepatitis C, and we find people with hepatitis C in our clinics here, and we treat them. That needs to go together. So I encourage all of you, if possible, to screen and treat hepatitis C within the addiction treatment. And another thing that we are maybe doing differently from others is that we have an intervention for children who have parents or older siblings with addiction. So this group from 8 to 18, we have psychological intervention for these children, which they are at high risk for addiction and for other problems. So if we want to do a good prevention, this is the group to focus on. And we have been doing this for 14 years and has been recognized by in Europe from others taking our looking at this project as a lead. So that's what I had to say. Looking forward to Malta.
Thank you very much, Val. And there's a very special relationship between Iceland and Val and Thor and ISAM. They hosted the first major ISAM meeting in Iceland and had us at the president's house. So it's very special. So thank you.
2002.
That's correct. That was my first ISAM meeting. But thank you for all of your contributions to ISAM.
Thank you.
Awesome.
Nice to see you, Greg.
Now we have Peter Vossenberg from Netherlands.
Hello to everybody. Can I have the next slide? A little background, we're not the youngest organization. We were founded in 1985. We are the professional organization for physicians working in substance abuse treatment. And members of our organization can only be those who are registered as a specialist in addiction medicine. And to become a specialist in addiction medicine, you have to complete a 2 years training. The training has been working since, I think, 2007. So it's a pretty long time. And recognition as a specialist in addiction medicine exists still since 2013. It's important to realize that addiction or substance use treatment in the Netherlands is usually in specialized centers where we treat in a multidisciplinary setting all types of addictions, both substance use disorders, but also the behavioral addictions. The current situation for our organization on a national level is that we want to improve the training that is currently 2 years training, and we would like to expand that to a 3 years training. The program is already there, and we're still waiting for financial resources for the training. And one of our ambitions is that we want to work towards a full recognition as a medical specialty and as the central specialist in substance use treatment. Within the substance use treatment field, we are currently actually the only specialists that have had such an extensive training in substance use disorders. We also like to expand access to treatment. Currently, we're mainly working in substance use treatment centers, but quite a few people with substance use disorders are seen in hospitals, and we think that there is enough room for substance use treatment specialists in hospitals as well. Can I have the next slide? What we expect from ISAM and other organizations is cooperation, and we like to see that other organizations and other countries are also working to have addiction medicine recognized as a specialty. And what we also like to see is regional accredited education programs, especially the online possibilities that we have should give us ample opportunities to realize something like that. We think that we can contribute our. Can we go back to share knowledge on the training for addiction medicine that already exists in the Netherlands? I know that especially Cornelius de Jong has been doing a lot of work on that field, and we can also participate and co-organize symposia, congresses. And for those who are interested, in May, the 20th of May, we have one of the 2 days of our yearly conference that will be in person, but that will be also in English. Thank you.
Thank you very much, Peter. Thank you very much. Now will be Evgeny Krupitsky.
Hello. Thank you very much for inviting me to participate in this excellent meeting. I'm a professor of psychiatry and affiliated with 2 big research state-funded institutions in academia, basically related to psychiatry and addiction psychiatry. There are 2 major associations of addiction psychiatry societies in Russia. The first one is a section of addiction psychiatry at Russian Psychiatric Association. This section, the Russian Psychiatric Association, is quite big and influential professional society, basically includes psychiatrists and licensed clinical psychologists. It is a member of the World Psychiatric Association. Russian Psychiatric Association holds a number of regional meetings in Russia every year in different regions, and a very big congress of all Russian psychiatrists every 5 years. The activity of scientifically oriented rather than practical, and it has many other activities like discussions of new achievements and regulations, and its website, important recent publications, standards of care, news, extensive international collaboration, etc. Next slide, please. Next slide. The second association is Association of Addiction Psychiatrists. It's smaller. It includes basically heads of services of addiction psychiatry in all regions of Russian Federation, and some medical practitioners, addiction psychiatrists, nurses, licensed clinical psychologists. It basically includes the activities basically includes meeting in Moscow on the annual basis, and in those meetings we have discussions of technical issues of functioning of addiction psychiatric services in Russia. It is more practical rather than scientific society, and it does not have extensive international connections. It also has many other activities like discussions of new achievements and regulations, and its website, important recent publications, development, standards of care, news, etc. Next slide, please. What our organization's members expect ISEM to provide? It's first of all international collaboration, information about recent achievements in addiction medicine, opportunities to publish in the international scientific journals and to participate in the international conferences. What our organizations can contribute to the global community of addiction medicine societies are publications on new developments and achievements in the Russian addiction medicine, participation in the international congresses, and participation in collaborated joint research projects. That's it. Thank you very much.
Thank you very much, Evgeny, for joining us today. Now we go to Lithuania. Darius.
Hello from Lithuania. I am Darius Jokubonis, and I work as a psychiatrist and at National Center for Addictive Disorders, and also I'm affiliated to Psychiatry Clinic of Lithuanian University of Health Sciences, where I'm in charge of addiction round for and training for residents in psychiatry. And currently I serve as a chairman of the Lithuanian Association of Medical of Addiction Psychiatry. Our association was established in 1998 to promote change and development of new modern treatment methods in addiction treatment. And it has currently 20 members, and most of us are psychiatrists in practice. Several of us are also affiliated to faculty and research and education. And also we have one member in retirement, and we encourage members to, after retirement, to stay in contact and to stay in the society. And also we're very proud we have one nurse dedicated for practice to addiction. Current situation in the organization is that we look for advocacy and delivery of quality services for patients and for families. And actually we like the saying that if you want to change and to develop, you should start from education. So educational activities now are the main vector of our society. Also, we look strongly for collaboration. Next slide, please. Actually, we look for the possibility to strengthen the capacity of addiction medicine in our country while affiliating to ISAM, and already we collaborate with educational committee of ISAM and Professor Cornelis de Jong for several years already, and we look forward to collaboration within the community. So thank you for your attention, and thank you for invitation.
Thank you, Darius, and welcome as one of the newest members of ISAM affiliate societies.
Thank you.
Now we have Michael Bish from France.
Thank you very much. Good morning, good afternoon to everybody. I'm glad to be a part of this ISAM meeting on behalf of the president of the French Fédération of Addictology, which is Professor Amine Benyamina. I'm a hospital practitioner and head of an addiction medicine department at the University Hospital of Nancy in the east of France. Thank you very much. So a little background about the organization and its members. The French Federation of Addictology was established in 2000. There are 20 members, which are national associations, federations, learned societies, and foundations, all working in addictology. It groups together nearly 900 members from these 20 associations. The major fields of our organization is studying, teaching, and research, fundamental and clinical research in the different areas of addictions. But also development of medico-social structures for prevention, care, and rehabilitation in the same areas. The French Federation of Addictology also develops assume developments of the means of action of the members and increase their effectiveness by pooling information and coordinating their work programs. about the current situation in the organization, national levels, priorities, challenges, needs, and services. Dealing with prevention, the French Fédération of Addictology support the Défi de Janvier in French, Dry January, but also a month without tobacco in November. For care with patients, we are especially involved in dual diagnosis, care and treatment, and ADHD, dual disorder with substance use. Dealing with politics. In France, there is the E20 law, which is a law protecting people from lobbying of industrials of tobacco and alcohol, and we support this law and cannabis legalization and medical cannabis access. Next slide, please. What do the French Federation of Addictology expect from ISAM? Maybe support for the advancement of knowledge about addiction medicine in France, support for political approaches of addiction in France. You know that France is worldwide known as the wine country, and all French addictologists must frequently struggle against alcohol lobbyists. Our organization can contribute to the global community of addiction medicine societies, maybe contribute to expertise in the different areas of addiction, and support for research with networking of the French teams with other research teams. That's it for me. Thank you very much.
Thank you very much. Now we have Dr. Garrett McGovern from Ireland.
Thanks very much, Hamid. I want to thank you and Greg and Alex and all the organisers for a really fascinating and great networking seminar. It's been terrific. Thanks. Next slide. Yeah, so a little background. We're really a fledgling organisation, and we're trying to bring together Irish physicians. Traditionally in Ireland, and really it hasn't changed as much as we would like. The addiction kind of area or field has really come out of opiate substitution treatment from the heroin epidemic back in the 80s and the 90s. I mean, we were probably 10 years too late in Ireland to get opiate substitution treatment, but we all got involved in this, and we've always been trying to improve our educational opportunities. The training of addiction in Ireland is not particularly brilliant. We're not recognised by the Irish Medical Council, so it's very, 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 very difficult. So really this networking, I'm trying to bring as many of our own physicians together with the international community. As I say, we also have recently, with great help from Alex actually, and others in ISAM, we've set up a CPD, and you know we're looking to expand that internationally in time, and you know see what the other experiences are. Current situation in the organisation. So we really need we have an urgent need now for an addiction medicine workforce, because I've recently taken on a role as a clinical lead in the Midlands and Louth Meath. It encompasses about 6 counties in Ireland. Ireland has 32 counties, and we have a lack of treatment in those areas. There are people down there on waiting lists for opiate substitution treatment. We also mindful that the drug landscape has changed over the last 10 years. We're seeing a lot more different drugs, a lot more prescription drugs. When I started out, it was really just heroin. It was methadone treatment. We were latecomers to buprenorphine, so it was difficult. We want to be able to expand our membership and tap into as much international expertise as we can. Next slide. What do our members expect from ISAM? It gives our organisation the international gravitas, and this will encourage more doctors to enhance their knowledge and expertise. And we're hoping we can have our own conference here in Ireland in time. you know, ISAM through its international certification exam provides a very, very unique credentialing qualification, and I'm trying to encourage as many people here to get involved in that. It could be a way of gaining specialist recognition with the Irish Medical Council. It's a work in progress. What can your organisation contribute? There are a huge number of doctors with vast experience, have a lot to contribute to the world of addiction over here. RSAM could provide a link between this organisation and organisations internationally. And we're hoping that in time, there's going to be a training pathway for people working in this area, and that it will get specialist recognition by the Medical Council. Next slide. That's it. Thank you.
Thank you very much, Garrett. Thank you very much for presenting. And now we have Jorgen. I think Jorgen had to leave, and we should have Gabriella.
Yeah, that's correct.
Gabrielle Wellstrand is going to be presenting for Norway.
Yes, I'm here. Can you hear me?
Yes, perfectly.
Okay.
Yeah,
I can hear
okay.
you.
So I don't look exactly like Jorgen. First, about the Norwegian Association for Addiction Medicine. It was started back in 2005, mostly as an interest organization for lobbying the establishment of a specialty for addiction medicine. And in 2015, it was decided that we'd have a full specialty in addiction medicine. It's part of the Norwegian Medical Association. We have a full 5-year specializing with standardized curriculum and I think around 12, 15 teaching hospitals. I think Jorgen was a bit optimistic in his numbers. I think there are about 500 members in our association. There are 140 full specialists, and there are 200 candidates, many of whom soon will have this specialization, and we also have the supportive members. The current situation about the organization and national levels, the Norwegian Association for Addiction Medicine is alive and kicking, as Jorgen put it. We have got good recruitment and high activity and optimism, and we are really happy to share our experience and about how to, one back please, to share our experience about what is happening in Norway and how we accomplish the full specialization. When it comes to treatment, low coverage, as Jorgen has written, but internationally not too low, I think. We have a high level of idealistic initiatives in treatment, and we have high political interest. That means money is coming, discussion interest, and the bad part of it is the more sort of populistic and non-evidence-based measures. We have just this year started heroin-assisted treatment, and what is fast, I don't know. So that's, we have animal-assisted treatment, and we also have work initiatives to study how how is it called? The IPS works in addiction settings. Next slide, please. And I think Jorgen told me that he was a bit too pessimistic here. Of course, we have expectation to ISAM from NFRAM. We like the international cooperation and learn from others. And it's, of course, also a potential place for networking and learning from other members. We are happy, as I said, to spread information on our specialty in addiction medicine. And also the increasing interest in both the somatic and psychiatric care for patients with focus on evidence-based medicine. And last year was how much money the Norwegian Research Council spent on addiction research. Thank you from Norway.
Thank you, Gabrielle. And that was a great conference you put together in Oslo. When was that? What year was that? Back in
2011, I think.
Okay, wonderful. Yeah. Thank you.
Thank you very much. Now we go for Michal Miovsky. Michael, are you
ready? Thank you. Good morning, evening to everyone, wherever you are. And I'm representing Czech Society of Addiction Medicine, and also I'm representing International Consortium of Universities on Drug Demand Reduction, where we have almost 300 member universities with addiction specialty programs. But today I will speak about our Czech Society. May I ask you for next slide? Thank you. Our national organization is relatively small. We have just over 200 members, but this is just core organization, and we are representing 4 other different addiction societies in Czech Republic. And the core society has a full continuity with the former section of addiction psychiatry under umbrella of Czech Medical Association. So I try to highlight our priorities and challenges. And the number one, what we are challenging right now is our national-wide project, because we received really generous support from the government for developing national clinical guidelines. And that's absolutely top priority for our association today. At the same time, we are working continually on quality standards and guidelines for addiction professionals, and that's also our core issue, what we are contributing and cooperating with ICU-DDR, working on competency models and issues like that. And number 3 is probably our specialty, because it's about quality standards for service professionals in prevention, treatment, and harm reduction. And we are operating a nationwide system, assurance quality system, and accreditation for service providers in this area. And this is something what we try to improve, and that's also issue for cooperation, what I will have on my next slide, if may I ask you. Because what we are expecting is exchange of experiences, and despite the fact that we have 30 years since Velvet Revolution, I think that Czech Addiction Society is still relatively close, and I try to emphasize the international aspect and cooperation. And we would like to have a better information and collaboration in the area of clinical guidelines. And as I said before, that's priority number 1. And we are working on systematic review right now and try to adapt what is adaptable for our national context. And the same situation is with quality standards. We are participating on European-wide quality project Phoenix, and the second European-wide project WAVE, and both projects are focused on quality standards, and that's also our role and small contribution to this cooperation. We have what we would like to provide is contribution to international community in terms of sharing our materials. For instance, we have a relatively, as I mentioned, we have a relatively highly sophisticated system of quality assurance, what we have started and developed more than 20 years ago. The quality of workforce is the second issue. And for instance, we are able and we provide and operate international online course on prevention called INAP. And we have this course in 5 languages, and I sent you link into the chat. We are operating international open access journal called Addictology, and we are operating this journal together with International Society of Substance Use Professionals, and that's something what we can provide and invite you for contributing. And that's just beginning of this collaboration with ISAP, but on the other hand, I think that it's also something what is considerable for ISAM collaboration, and I would like to use this opportunity and invite you. And last but not least, I would like to invite you, and that's also something what is our contribution, and it's about linking with both international bodies like ICU-DDR, Consortium of Universities, and ISAP, International Society of Substance Use Professionals. And I see many opportunities in collaboration between our bodies and members. And thank you for inviting me. Thank you.
Thank you very much, Michael. Thank you. Now we have Christos from Cyprus. Christos,
hello, everybody from Cyprus. My name is Christos Minas, the chair of Cyprus National Addictions Authority, and I am pediatric surgeon. It's a big honor for us to be a part of your society, and thank you honestly for this opportunity. Our Addictions Authority was founded in 2001, and it's the main coordinating body in the field of licit and illicit substances. Also, we are responsible for, among others, drafting and monitoring the national strategy and our action plan. No person or entity shall apply any measure or intervention without obtaining our National Addictions Authority authorization. Our national levels in priority challenges, needs and services. Our National Addiction Strategy 21-28 places the individual at the center of interventions and considers substance use and addictive behaviors as a matter of public health. We promote evidence-based measures and interventions, both in demand reduction, prevention, treatment, harm reduction, and social support, and also in supply reduction. Our tries is to safeguard human rights at the forefront of our policy. Next slide, please. Regarding what our organization expects ISAM to provide, I would say that networking with professionals and experts from the field on a worldwide level, to exchange of knowledge and best practices, especially concerning innovative approaches, and to review a presentation of research in the field of addictions. Through our organization, being part of ISAM, we can contribute by, I would say, to share our experiences and lessons, learn from the implementation of an integrated national strategy for all licit and illicit substances, as well as other forms of addiction, gambling, and maybe soon internet, under our authority, to present best practices that have been implemented in Cyprus for some time, some alternative to imprisonment, and to connect local experts in addiction medicine to their global peers. Thank you very much.
Thank you very much. Now we have Alexander Konchtelov from Bulgaria.
Dear colleagues, kind regards from Sofia to everyone. It is my pleasure to speak on behalf of the Bulgarian Methadone Treatment Association. We are a professional organization that is founded at the end of the 2003 in response to the harsh heroin epidemic that spread in our country at that time. We are an organization that unites leading Bulgarian professionals in the field of drug addiction treatment, training, methodology, research, policy planning, and development. And we are proud to say that over the years, Bulgarian Methadone Treatment Association had actively worked to assist the development of the national treatment policy and treatment centers network development in our country, as well as treatment standards, regulations, and guidelines for quality care. Currently, of course, as all the world and all Europe, one of the main challenges for us, I would say the only one main challenge is in this difficult situation to maintain high quality of treatment service despite the pandemic conditions. And that among the top priorities for us are to pay the needed special attention to complicated patient cases, to adequately focus on dual disorders problems, to properly address polydrug use among patients, and to maintain psychotherapeutic work and therapeutic relationship in online formats that are unusual traditionally, and restricted face-to-face contact. What we expect from ISAM is clearly that ISAM has the capacity to provide possibilities for professional networking and communication, both regional and worldwide, and also to present and share and discuss among the professional communities best practice treatment models and provide forums for competency sharing and development and discussion of successful practices, especially in new technologies related to new world conditions and specifics of addiction telemedicine. What our organization could hopefully contribute, it will be our pleasure to do that, is related to our capacity to provide examples of successful policy development at national level and to share therapeutic and treatment models of quality addiction care, and also to share the integrated treatment models combining different change levels and collaboration at medical, psychiatric, and psychotherapeutic teams and levels, and also successful examples of interdisciplinary collaboration. Thank you very much.
Thank you very much, Alexander, from Sofia, Bulgaria. Now, at last not but least, we have Sharon Robinovitz from Israel. Sharon.
Thank you very much. Hello and greetings from Israel. First and foremost, I would like to thank the organizing committee for this exceptional event. It is a great pleasure to take part in such an international collaborative effort. My name is Sharon Robinovitz. I'm a professor of psychology from the School of Criminology at the University of Haifa. The Israeli Society of Addiction Medicine comprised of professionals committed to advancing knowledge about recovery and treatment of substance use disorders and addictive behaviors. Physicians, psychologists, criminologists, social workers, and the other para-healthcare professionals. With the growing membership of over 150 members, ILSAM offers impactful advocacy in forms and shapes, drugs and addiction-related legislation and regulations to advance high-quality, evidence-based addiction care. ILSAM initiates and supports continuous scientific, clinical, and educational activities that aim to improve the prevention and education, the prevention and treatment of behavioral and substance use disorders. Currently, our most urgent priority is to establish consensus and positions documents, including practical guidelines following recent cannabis decriminalization and ongoing legalization processes. Also, we'd like to enhance cooperation and integration of various stakeholders in pursuing ILSAM's mission. We can contribute to our fellow addiction, next slide, please. Thank you. We can contribute to our fellow addiction medicine societies by sharing our experience, exchange ideas to promote innovation, excellence, and diversity, our mentorship, collaborating in multi-site interdisciplinary research, mutual visits, and collaborative work groups. And also we would love to co-organize and host workshops as well as ISAM Future conferences. Thank you.